there are things that you know, and there are things that you live. What I mean is, everyone knows that exercise is good for you, but not everybody exercises. That's the difference between knowing something and living something. And then we'll talk about stress, because that's actually another one. In fact, in some ways, it's an overarching theme, because how do I deal with all these stressors that I'm dealing with, including social isolation, including all the symptoms that we've talked about. Maybe there are a few surprises. So here are the images I was referencing. When you're completing cancer treatment, at least the acute part of the treatment is you're walking out of the tunnel, which, by the way, has been for many people quite comfortable. There are attentive healthcare personnel at the ready much of the time. If you have a question, you can get it answered. If you have a symptom, you can have it addressed. And then at some point they say, okay, go forth. We'll see you in 3 months or 6 months or for whatever it is for your check-in. And everyone is happy around you, and you may be happy for a minute, but then there is that existential question. Okay, where do I go? Now what? And it is that question. This is the opening verses for Dante's Inferno, where he wrote, "Midway upon the journey of our life, I found myself within a forest dark, for the straightforward pathway had been lost." You know, um, Cancer is on no one's bucket list. Nobody plans for it. And then many people don't plan for when it's over because there is a thought that, okay, it's done, I'll go back to the way things were, except you can't. As far as for us human beings, we move through time in only one direction. And there is no, in reality, going back to anything. So the question is now what? Um, you don't need to know. I mean, you know all of this stuff already, but I'll tell you this is the interesting thing because it's fairly universal. There was a survey by the American Cancer Society where they interviewed over 16,000 cancer survivors across all dimensions of cancer, so it's not specific to head and neck. But here are the top five concerns. Um, 1 in 3 are more or less the same, but they fit into slightly different categories. The fear that the illness will return, meaning that they were told it's gone. Fatigue and loss of strength, like they're in some chronic state. Number 3 is they're in some chronic state of ongoing treatment and worry that they'll relapse, general fears about the future, and frankly, sleep difficulties. Um, Inside fears about the future are questions of how long will I live now? My finances, what to do, what will happen with my family and my children. So it's a pretty general category. Um, And there is something that's critical. I mean, for over a decade, almost a decade now, the world of caring for cancer survivors has been at the forefront of oncologic care, which is phenomenal. Um, the thing that is relevant to this conversation is the third one. Um, because if you'll notice, by the way, none of these priorities explicitly mention people's mental health concerns, anxieties, how they cope with symptoms. It's in that bucket called interventions for consequences of cancer. In the rates of depression for head and neck cancer are higher than the general population, and they're actually higher than most other cancers, and that includes cancer survivors. The rate of completed suicides amongst cancer survivors is up to 3 times the normal average within the first 6 months. And it doesn't go down, it goes down, but not very much within the next 2 years and beyond. There's always a higher rate of completed suicides amongst cancer survivors, and the rates for head and neck cancers tends to be even higher. So the question is, how do you deal with this? And I invite you to look through the lens of your own experiences because the stress isn't going away. There are just different stresses. Um, I want to say a couple of words about stress because stress has gotten kind of a bad reputation in our age. Stress is not a bad thing. Stress is a very simple scientific term. It's how It's something that pushes the body away from its balanced state. Stress is the response to that. So if something pushes the body off of its balanced state, there's some stimuli or some impact. The stress is how you respond. And there are actually two different types of stresses. One word is familiar to y'all. It's distress. It's become a word in our language. It was coined by Hans Seiley, who was a researcher at the turn of the last century, middle of the last century, where he studied stress on the cellular level and then started to look at, oh, animals and people experience this too. Let's look at that. So distress is when you have a negative response to whatever's happening. The other word isn't commonly used. It's eustress. You means you and dis are Greek prefixes meaning good and bad. Because there is that positivity, there is that joy of, oh my goodness, I'm feeling better and I have this new lease on life. Let me go live some ways that I haven't been able to before. So we sometimes, and sometimes when people come like me come and speak in groups, it's all about the negative, but there's tremendous joy available. And I don't mean joy like giddiness, because that's a fleeting thing. I mean joy like the fulfillment or satisfaction of pursuing something that is meaningful to you. See, eustress is it's motivating. It's seen as something within your capacities. It feels exciting. It actually improves performance. Whatever it is you're up to, when you're in that state of eustress, you're going to do better than if not. The way a little bit of anxiety is actually pretty good for when a student is taking an exam or studying for an exam. Too much is impairing. Too little, you don't have any motivation. So this young man, by the way, I love this picture. He is a contestant on the Scripps National Spelling Bee. And this is a guy who's experiencing some eustress. He's about to move on to the next round. His heart's probably racing. He's got a little flutter or sweaty palms or however he experiences it, but he's ready for the experience. Whereas distress is when the thing that we're dealing with seems beyond our abilities. And it causes anxiety, it causes concern. It can be short or long term. This is what can lead to mental or even physical problems. And it feels terrible. It just does. And mostly when people say I'm stressed out, this is what they're talking about. But it's actually so much more than that in the setting of medical illness, because in the setting of medical illness, it's the chronic every day after day of being reminded that there are things that you no longer can do that you want to do or that take more effort. Um, or the worry about what does this symptom now mean? Or, I'm having a harder time swallowing. Will I need to have another dilation? Like it's just all that frustration. Or, my goodness, I'm kind of tired all the time. I don't want my spouse to have to keep taking care of me, but she kind of does, or he kind of does need to do that. So in survivorship, which is it? It's actually a matter of context. Context meaning the frame in which you're holding the thing. Another way to think about it is, how do I develop resilience? Resilience is not innate to anyone. Resilience, psychological resilience, that is. Resilience means just the ability to recover quickly. The faster you can recover, the more resilient you are said to be. By the way, being more resilient isn't better than being less resilient. It really isn't. It's kind of like, which is better, to run a mile in 10 minutes or to walk a mile in 30 minutes? It's not that's the wrong question. The question is how you get to the end of the race. And one of the things people tend to do, which is completely natural and human and ultimately self-defeating, is they compare. Oh, that person seems to be doing better than me. But resilience is simply your capacity to bounce back. And yes, some of us want to bounce back faster than we do, but the point is to be in the process of bouncing back, however long it takes. Yeah, because the context could be for a lot of it is, and especially in medicine, I'll own it as part of the field. The context really is like, what's wrong? Like, what's wrong? And it's appropriate. Like, what's wrong with you today that you're coming to see the doctor? Cancer is wrong. Um, the way my current physical state is shouldn't be the way it is. I ought to be doing better. I should be more positive. That's one of the ones that often gets you when people tell you to be positive when you're not, when you're having a down moment or a down set of moments. It's really tough because then it's like beating yourself up for for feeling bad. Anytime we say, I wish it was better, all we're doing is is saying that what is happening now is unwanted, which is fine, by the way. Again, but what's happening now is what's happening now, wanted or not. And the question is, how do I live inside of the tension between, okay, what is happening now is actually happening, and I get to say what I do with it. What if there's nothing wrong with the way things are? What if it's just the way it is? One of the most poignant, heart-touching things that I hear over and over again is some version of it wasn't supposed to be this way. Which on the one hand, um, is completely human. Like we all do have a vision for our lives. On the other hand, it's completely illogical and makes zero sense when you really examine it because none of us have a roadmap of what's coming. And so we often compare what's happening to the imaginary roadmap that we had for ourselves. And then we say it wasn't supposed to be this way. It shouldn't be this way. Completely human. What I'm offering you is a potential alternative to practice, which is what if there's nothing wrong with the way things are? Now, you may be thinking, oh, then does that mean I'm going to do nothing? Of course not. I'm going to be complacent. Of course not. But it might give you some space to breathe in this moment and think and take different action. See, if there's nothing wrong with the way things are, or even with the way things were, you could actually have a little bit more freedom. Freedom to ask for support, freedom to learn how to be more resilient, freedom to share the burden. Really, it's one of the toughest things, given that the vast majority of people with head and neck cancer tends to be men. And as men, we tend to be less good, worse than women at forming social relationships and asking for help, especially as we get older. That's a tough one. And this is really important. How do I share the burden? And how do I practice this thing of hope? Yeah, things look the way they look now, and I'm going to intend and stand for it and take action towards it not looking this way. In other words, how do I decrease my stress and how do I enhance my resilience? And you can do both. And, this is a great quote from the Shakespeare play Henry V, where one of the characters says, self-love, my liege, is not so vile a sin as self-neglecting. And it really does start with the willingness to stand in, okay, things really are the way they are. Maybe, just maybe, there's nothing wrong with it. I got that I don't want it. That's clear. But maybe there's nothing innately wrong with it. Now, what can I do in service of whatever it is that matters to me, in service of a vision that I have for myself, my wellness, my life? In other words, you usually don't have a say over the circumstances you find yourself in. Like, I wish there wasn't traffic on the highway. I mean, like, okay, that's kind of a silly wish when I'm sitting in traffic. All it does is reduce my satisfaction and happiness in that moment. See, you do have a say as to how you're going to be about them and how you respond to them. And that's what I'm pointing to as the beginning of resilience. And there are five major categories. The first one isn't a category. The first one is redundant. And these are not exclusive, by the way. There are other categories, but this covers the majority of the spheres of activity around enhancing resilience. One is connecting with people. The other is setting appropriate boundaries and limits, really partnering with the medical team. This is kind of like when you insist on getting the answers to your questions. Really tell your story, your experience of it, which is why support groups like this one are so vital and necessary. And then practice what we call hope, or like this elephant, balance is the key to life. And I assume this is a Photoshop picture, but one never knows. So in the world of self-care, there's like, be human. Us and plants, we have a lot of genes in common. You need sleep. That's an error. The eight shouldn't be there. You need whatever sleep you need. 8 hours is not correct. Some people need three, some people need 10. Whatever you need. Eating, exercise, sunlight, watering, and you do what you enjoy. And if you can't, be kind to yourself. And as human beings, we get sad, we get angry, we get tired, we're happy. That's okay. Let it be. And the challenge is, another is, how do I, it is an open question. I'm not saying there's a should here. There isn't. Is it, did I have cancer and I'm dealing with the consequences of it? Am I a cancer survivor everywhere in my life? Is that who I now am? Or is this a part of my life that I deal with, but doesn't define my entire experience or existence? Is it something that happened to me, or is it something that I am? And again, one isn't better than the other. They lead to different experiences, they lead to different sets of actions. Um, some people have other ways to alleviate stress. What the psychiatrist is saying to the patient, stress relief techniques include meditation, slow breathing, and visualization of chocolate bars. The second, and this is a tough one for some people, is connecting with people. That's why I'm just going to repeat myself. Groups like this are essential. And as two of you already mentioned, the social isolation of being cancer survivor is really tough. Psychotherapy is also incredibly helpful, both individual and therapist-led group therapy. One of the reasons that is so challenging, from my experience, for folks who've survived cancer to re-engage with their previous social networks, um, is they don't know how to talk to you. And it's hard for you to have the experience of being heard or seen when you're surrounded by people who haven't dealt with what you've dealt with. So it can be isolating. And for some people in your life, the fact that you had cancer is a stark reminder of their own mortality. So it's hard to be with you. One of the things I provide as an offering is is rather than being disappointed in people for them not knowing what to say or them not being comfortable, you could flip the script. What I mean by that is teach them how to talk to you. Tell them what you want them to say. Tell them what's okay to ask. Tell them what you don't want them to ask. People need guidance. They are clueless. And you're the one who has the answers. It's kind of like, when when one romantic partner tells the other what to buy them for their birthday. It's like, rather than you having to guess what to buy me, I want you to buy me this, and then I'll be happy. It's kind of like that. And then you have much more of a sense of agency when you're with people that you like or even care for deeply that you don't know how to communicate with all of a sudden. On the other hand, is this. There is the other hand, which is saying, or related to, setting boundaries is really important. It's hard to say no sometimes. Like you may not be up to living in to the same degree of intensity in certain areas. Rather than being disappointed again, this is things shouldn't be this way, or this is how it is. Okay, this is what I now can do. I wish it was different for sure, but I'm going to enjoy myself this way. If there are people you don't want to spend time with anymore, it's a skill to learn to limit that. It's okay to be selfish from time to time, and there's nothing you have to prove. Not really. I mean, you may think that you do, but in reality, there's nothing you have to prove. And then another one that's often not thought about when it comes to resilience is um, it's a new leg of the cancer journey with it's actually much more obvious in head and neck cancer. But even so, um, it's really important to insist on having your needs met, having your symptoms addressed if they're not. Because medical providers are human and they have their own perspectives and biases, and you may come in with some physical symptom and they may have to prep someone for surgery, or someone has just got their cancer diagnosed and they're going to spend an extra half hour with that person and be late for you. And it's okay. Insist. And then tell your story, whatever that looks like, with others, with some external expression of your creativity. Um, and lastly, I'll say practicing hope. And this is one where I'll stop after this and see what this has provoked for you. Um, if there are other things that you want me to address. Um, by practicing hope, here's what I mean. Again, this is one of these words that we think we know what it is. Um, and then so the hope is intending for some desired outcome. That's what it is. It is an active verb as much as it is a noun. In fact, you can't have hope as a noun without doing hope as a verb. Why is that? It sounds a little esoteric. Here's what I mean by that. We treat, and I mean, you, me, your doctors, nurses, your family members, people in it, we treat hope like it's a thing, like it's a commodity that you can run out of or that you have to stock up on. You'll hear people say things, well, I don't want to give them the bad news because maybe they'll lose hope. Like hope is a set of car keys. Hope is essential as a practice, especially when things look bleak. It is simply intending for a desired outcome. And, we live in a cynical age where sometimes when people are hopeful, we call them naive or Pollyanna-ish or even deluded. But I would offer that those people may not be any of those things. They may simply be hopeful. And it's something anybody can practice.